dementia with a mix of clinical work and being a clinical director. I work in a village practice of about 6,000 patients. I see patients from 0 to 100, literally, although in a rural area we are weighted to a greater proportion of elderly patients compared to the national average. I think COVID has been the catalyst for changes in telemedicine the industry probably has been waiting for a long time. Purely by the sudden onset of it and from necessity, telemedicine has been very beneficial through COVID. So remote consultations, video consultations, e-consultations, using apps such as Accurix for sending messages to and from patients, remotely accessing and measuring patients' variables at home, blood pressure, for example, remote monitoring of COVID patients themselves with oxygen at home, and also the development of smart watches from patients who are measuring their heart rate and data. So there's far more data, and I think that will just continue to increase over coming months and years. COVID-19 undoubtedly has been a catalyst. There are lots of awful and sad things from COVID, but one silver lining to it all has been COVID-19 bringing telemedicine forward leaps and bounds by many years compared to, I think, if COVID had never occurred. Remote monitoring of blood pressure, far more patients now have monitors compared to before, pulse rate, measuring things like irregular heartbeats, atrial fibrillation are all areas now that are far more evident. One thing that's decreased, I don't think video consultations have worked out as great, especially where I work in a rural area. It's very dependent on a really good internet service provider and fast broadband, and I don't think that works as well. But online consultations and Accurix text messaging to and fro of queries and data works well. There are or can be benefits to the patient, so they can do measurements remotely, save coming to the practice, maybe easier for them. Often they can measure it in a familiar environment rather than avoiding things like white coat hypertension when they come to the surgery. It saves them driving. It's even better for the environment. They can measure things at home and send recordings in. It can be more efficient for GP appointments or clinician appointments, whereby the data is sent through beforehand rather than taking time out of the consultation to measure things. So it can be cost effective, so it's taking costs away from the practice overall, less nursing appointments, less healthcare assistant appointments, potentially less GP appointments, and also you can save the need for next of kin to take patients to appointments, and so there are numerous benefits available, and I think overall, I think patients who do use telemedicine and clinicians who do use telemedicine ditto find it of benefit. Clinical outcomes can be difficult to measure as to whether they're using the machines properly. Are the machines calibrated? Is there a standard quality recognised machine that people can use if it's not provided by the surgery, or whether it's bought privately? How accurate and confident we are in the values. There is a danger of the inverse care law, where patients who are IT savvy, affluent, will often access this modality far more than the poor, and those with learning difficulties, for example, or those without a family to support them and aid them. So there is a danger that some patient groups will be left behind in this area. It can be difficult for certain groups to be able to use the IT, and they could be left behind, and there can be a bit of pressure on the family to help them in these scenarios. And there's a danger as well for primary care and hospitals to be overrun with reams and reams of data when actually there was no need. And patients who are, for example, anxious may over measure, and having telemedicine at home could actually compound their anxiety. They may continually measure their blood pressure, their heart rate, their oxygen levels excessively when there's no obvious acute clinical indication, and so yes, there are detriments potentially to this technology. This is only the start. It'll expand greatly. I think it'll be used for a wider array of conditions. So I think the ones that are currently already in place will expand further and be used by more patients and be more widespread adopted. I think new services could include near-patient blood testing, so patients have got used to lateral flow tests, so maybe in the future they could do their own urine test and send photographs in of the dipstick result. They could do like near-patient CRP testing for inflammation. Could they do that at home, for example? Could they have blood tests sent out to them? Do they need to come and see the healthcare assistant? Could blood test kits with finger prick tests be done for patients for routine monitoring? Again, that might be easier. And even things like from smartphones, so many people have smartphones, could attachments be made to listen to the heart to create more of a detailed ECG? Could you have attachments to measure 24-hour ECG? Could you have microphones to listen to heart murmurs? So all sorts. I think the list is huge, and I think it'll be expanded, and not many things will be stopped, but I think it just needs to be regulated. I think one thing that will go is the current, I guess it's a bit of a wild west in that patients can buy any old machine and any old smartwatch and wearable data device without any NHS guidance or expectations of calibration, of quality, etc. So I think that may well get more regulated, and an expectation of certain instruments being used by certain patients, and maybe actually more greater expectation of surgeries lending these things out better, whereas at the moment it's all a bit ad hoc and depends if patient surgeries have charitable funds, etc., to give them out. I think big pharma and pharmaceutical companies need to liaise with the NHS and basically create products to address needs, and not just create products that they believe would be needed. So you do want to create a product that fills a gap that wasn't really there. I think industry, pharmaceutical industry, technological industry could aid with educating patients. They could aid with providing helplines to patients if they have difficulties. The last thing you want is these patients to be referring the surgery continually with queries. They could provide a library of equipment to be rented out. So yeah, I think they're the ways really to allow greater uptake. We want really greater uptake, more efficiency of the NHS without too much time being taken with the intricacies of running such a process. So any help they can provide, whether that's training for patients, nurse support, maybe remote nursing support, even help analysis of measurements, that would be valid and much appreciated.